Hi, I'm Dr. Michael Taggart with the Kirkland Thyroid Institute, where we specialize in the treatment of chronic thyroid issues that have not responded to traditional medical care. Today we're going to be talking about secret number 9 to help you get your health back from chronic thyroid disorders. Now, what we'll be talking about today is some substances that a lot of times people might take on their own to help them. They may go on the internet, or they might go to a health food store, and sometimes there's two substances that might be recommended. One is called iodine, and one is called tyrosine, so we want to talk about that today. So let's talk about iodine first. Iodine is very important. It's vital for thyroid function. One of the problems with iodine also is that it also is a very important stimulator for what's called TPO, which is an enzyme that your body makes with the help of iodine and some other proteins that will actually eventually make your thyroid hormones. Now the problem is that if you take excessive iodine, it will make more of this TPO enzyme. Now the problem is that if you have an autoimmune thyroid problem, which is the most common cause of chronic thyroid issues, you've actually just created more of the substance that your immune system is attacking, so you're going to get worse. So it's just like throwing gas on a fire. It's not a good thing. Now, how would you know if you have autoimmune thyroid? Well, there's a couple things. Symptoms can be important and can be a guide. Also, testing. Symptoms of autoimmune thyroid would be low thyroid symptoms and a combination of high thyroid symptoms. So sometimes you have low thyroid symptoms, sometimes you have high thyroid symptoms. Also, another symptom, or actually another way of helping determine that would be certain tests. You may have noticed on past blood tests that your TSH is like all over the place. Like 1 month it's high, then it's low. It just never stays in a certain range. That indicates that you probably have autoimmune thyroid. Also, having antibodies tested is an important thing to know. Now, sometimes the antibodies won't test positive because the immune system waxes and wanes as far as attacking the tissue. That's an important thing to check. If you test positive on thyroid antibodies, you definitely have it. If you don't, doesn't mean you don't have it. So there's another test that we do. And another test that we do is it's an immune test. They're called Th1 and Th2 panels. And what that does is it tells us what's going on with your immune system. So in your immune system, Th1 and Th2 are different sides of the immune system. So Th1 has to do with your T cells. Th1 is your body attacking things. Thinks there's invaders and attacks things. Th2 it makes antibodies. So if you're out of balance in your Th1, like it's overdoing it, it's going to kill things that it shouldn't, like your thyroid gland. If your body has too much Th2 activity, it's putting a tag on something for the Th1 to kill it. So either way, we're going to get a tissue destruction. So based on symptoms, also based on specific tests, we can find out if you have autoimmune thyroid. Now the next thing I want to talk about is another substance called tyrosine. Tyrosine, like iodine, is also very important for making thyroid hormones. The problem with tyrosine is that it stimulates epinephrine and norepinephrine activity, which can overstimulate your adrenal gland. Now, typically with patients who have chronic problems already have an adrenal gland that's overstimulated, so if you take those things, it can actually make you worse. So the big concept of today's discussion is really to have the testing done and not try to do something that could actually make you worse. So find a qualified doctor like myself who specializes in thyroid disorders and get the proper testing done. So if you're ready to get your life around and make improvement and get your thyroid condition handled, give us our office a call at 425-821-1100.